You are watching Dominion Television.
Hey guys, it's me, your doctor, Dr. Nathan Kwablah, on Real Health Revealed on COVID-19. I know you still have some questions concerning this pandemic and this new disease, and so that's why I'm here today to help you answer those questions. I'll also help you take care of some of those myths and then give you a few tips to help you navigate these murky waters. So you are pregnant or you are breastfeeding and you want to know what coronavirus means for you. Now, ideally, coronavirus does not change how it affects anybody who is pregnant or breastfeeding. However, it's a new virus. We are still learning so many things about it. So guys out there, ladies out there who are pregnant or you might be breastfeeding, would like you to also stay safe, stay at home as much as possible, keep a safe distance, practice the health hygiene conditions. And also, if you are somehow diagnosed of COVID-19, it's important to make sure you talk to your obstetrician or your midwife or your doctor who is taking care of you so that they can prepare adequately for your delivery. Remember that COVID-19 doesn't make you less likely to deliver or put you at great risk of having a bad pregnancy. It can, however, cause those serious diseases or illnesses that causes difficulty in breathing, high temperature, or what we know affects everybody else. So if you're not well or you're not feeling too good, you want to know if it's okay for you to visit your doctor or your usual clinic or hospital. Yes, it is okay, but there are a few caveats to that. You have to make sure that you are visiting a health facility that has the measures put in place to screen and then also practice good hand hygiene. We don't want you to keep your illnesses at home and get worse and then something untoward happens to you. Please guys, don't do that at all. Make sure that you call ahead, find out what measures are put in place at your clinic, at your favorite doctor's place, like my place, and they can tell you what has been put in place. So what are some of the things to look out for? First of all, when you get there, look out for the hand hygiene areas. It could be a Veronica bucket or some sort of sink to help you wash your hands. It can also be hand sanitizer that have been put in particular places to keep your hands clean. And then there are areas for screening. They can ask you particular questions and then check your temperature and then help us separate people who might likely have coronavirus and people who less likely have it so that there's no mixing and spreading of the diseases. Remember that you should also wear your mask wherever you are going to, especially to the hospital, to protect yourself out there. So a lot of you, probably you have a child with you or your younger brother, they are probably bugging you, they want to go out, go to the mall, go get some ice cream, and you want to know how to protect your kids out there. Now, there are some simple ways. The first important thing is that you have to stay home if it's not necessary for you to go out. So in this period, please stay home. Keep the kids at home, keep them engaged at home, and protect them from being exposed unnecessarily. Now, if the kids must go out, for older kids, they must also wear masks. They must also practice hand hygiene by washing their hands and using hand sanitizers. There's no point with you, the adult, walking with your mask and then the kids are just there laughing and shouting and taking in all those goody droplets and infecting themselves and you later on. So please, the kids, older kids should keep their masks. However, with the little babies and infants, they cannot wear masks because their system, their breathing system hasn't been well developed to be able to cater for wearing of those masks. So what happens if you need to take the child out? Yeah, that's a tough one. Ideally, you should keep them at home as much as possible. But then, if they must go out, make sure that you are in your own transportation, for instance. Make sure that you are keeping them close by and then observing the social distance. That can help keep our little babies and infants safe. So what can you do to protect yourself from COVID-19? We've talked about so many things. I would like to add that, first of all, it's important to stay healthy. That means that you need to eat well. Eat really well. You need your greens, you need your meats, you need your vegetables and fruits. Those of you who don't like vegetables, please try and make sure you're doing that. It helps keep all those vitamins and minerals that you need to keep your immune system running and chugging along. And then also some exercise will help you. Drinking enough water in the day will also help you keep healthy. Other ways to help you prevent coronavirus, like we've learned, is to mask it up, hand hygiene, social distance. Keep your distance and stay healthy out there. You guys have more myths and we've gotten hold of them. We're going to run through them and I'll help you debunk them. So antibiotics, are they effective in treating the coronavirus, or you think that they are effective? Unfortunately, this is not true. Antibiotics are not effective against the coronavirus. I know that some places are using one particular antibiotic, but then this does not mean that you going out there to buy your flucloxacillin or amoxiclav or all those things you go out to the pharmacy to buy would help. Please stay away from that. So exposing yourself to the sun, or when it's really hot out there, you think that will help keep the virus away? No, that's not true either. The virus is spread by droplets. The sun, for what we know, or high temperature or hot weather, whatever it is out there that you think, is not going to prevent you from getting coronavirus. The important things are what we've taught you is the social distancing, health, hygiene, or just stay home, guys, if you don't have to go out. Maybe you are living in the temperate region, it snows out there, you think the cold is going to freeze the virus. That's another funny one. I don't think, and we know that does not help to prevent coronavirus either. Stay warm, importantly, but also keep the distance. Mask up, hand hygiene, stay home. Those things will keep you healthy. So my people out there that like to hug, touch, kiss, the fancy handshakes, this is the time to avoid that. Please keep the distance, 2 meters. And then don't forget, you need to mask it up, you need to wash your hands, use hand sanitizer, okay, and eat healthy. These are important for you. For more videos like this, click the like button, subscribe to this channel, share this video, and tell your friends about it. So until we meet again, it's me, Dr. Nathan Kwablah, on Real Health Revealed. See ya. Bye.